Was it started in 5th year? The books that people are using now in 5th year and 7th year, I started writing them when I was in 5th year.
Whoa! Hi guys, welcome back to my channel. My name is Sharon, and if you're seeing me for the first time, I make videos about medicine and medical related content. In today's video, we have a special guest on the channel. We have Dr. Moses Kazevu.
Hi guys, my name is Dr. Moses Kazevu. I am a medical doctor and will be here on the channel today.
Okay, that is very humble. Now let me describe you for you. Okay, so if you're doing clinicals or you're doing clinical rotations, or for the Chinese students who are doing like their internship, then you're very familiar with the name Dr. Moses Kazevu, because he has written the MK books, which have been so helpful for us students when it comes to studying, and they've really simplified a lot of things. So thank you so much for coming to the channel today.
No problem.
Okay, so I'm gonna start asking you questions
Okay.
now. Do you remember the exact moment you chose to study medicine?
That must have been a while ago. Initially, my plan was to become a pilot. As a child, I've always had this admiration for planes, and I've always wanted to become a pilot either way. So as a child, I've always wanted to be a pilot. Back when I was somewhere around 11 years old, that's how my mother fell ill and required an operation. It was that particular moment where I actually decided to study or to become a doctor. But all along, I think maybe just also the fear of all these plane crashes that you hear of, and I just didn't want any of that anymore. So that's how I decided.
Oh yeah, that makes sense. Are you scared of heights?
Yeah, very much.
Oh my god! Okay,
very
so how did you land on pilot?
I don't know, I've always had a knack for making things, seeing how things operate, and it's just always fun to look at planes flying to and from, and I've just always had an admiration, but I am afraid of heights. Very much afraid of heights.
What was your high school experience like academically?
So high school, well, I actually didn't do high school here. I did high school back in Botswana before my family relocated here, but I am Zambian. So high school back there was a bit different from the high school here. There was more of a focused type of learning, and it was very rigorous, and the teachers used to push us quite a lot. And it was okay, I guess. Somehow, I don't know.
What was your performance like?
It was okay.
I'm asking the real questions.
It was okay. I can't say it was bad. Okay, if you're looking subject-wise, right? My English was not so good. To be honest, it wasn't so good. It wasn't like off the charts. But all the other subjects, the math, the science, they were okay. They were frankly okay.
Oh, okay. What was your medical school journey like?
PTSD.
Oh my god.
with some happiness. I met a lot of friends. I met a lot of unique people during the medical school experience, and the thing about medical school is that you get different feels at different stages. If I could say maybe a third year was really like, you know, when you're at a party and you don't really know what you're doing there, why you went to the party, and that's how it really felt like. 4th year was a disaster. I actually almost quit medicine 4th year. Truth be told, I actually almost quit medicine at 4th year because it was just overwhelming. I think somewhere around half the year, we had tests coming each and every single week. I was so behind on studies. I literally thought that I couldn't do this anymore. But then I had a friend who kept encouraging me to keep going on, and that's how I still went on. But the rest of the years, I think the clinical years were bearable. 5th year was okay, 6th year, okay, 7th year, there is a bit of some pressure in the final year. But overall, I think it must have been okay.
Where did you go to university?
I went to the prestigious University of Lusaka Apex Medical University.
Okay, so those guys were right. Sorry. Like, there were all these students from Apex and they were claiming you, and I just didn't believe it. But, okay, I guess they were right. Okay.
Where did you think I went to university from?
I don't know. I thought at least Unza or something.
No. Initially, actually, university choice wasn't up to me when applying for university. What really happened was this, because I never had a gap year in between. So back in Botswana, we call them forms instead of grades.
Yeah.
So there's what you call grade 8 here is actually form 1 over there. So there's form 1, form 2, form 3, up to form 5. So I managed to do form 1 to form 5, then went into what is known as an advanced level, or the form 6, which is like A levels here. Just that my parents, when I was finishing the first year, because it's supposed to be 2 years, then they wanted to relocate here. That's how my dad was literally searching through, and I talked to some friends, and then he was like, oh, by the way, there's a school that's Apex by then. And then that's how he decided to apply there and didn't apply to any other university. And I got picked there. That's how I found myself there, actually.
Oh, wow. Your dad was like, you're going to Apex either way.
Yeah. Pretty much.
You decided in his heart.
Pretty much, yeah. He decided. I think we went consulting. I wanted to go to medical school, yes. I didn't really mind which medical school I went to, as long as I was in medical school. So I think that's...
Okay. Why did you choose to study medicine?
Why did I choose to study? Because I love to suffer.
I'm just
joking. It's a big influence in my life has always been my mother. She's always told me that wherever you go, do your best, help anyone that you can, and I've always carried that with me. And you know, it's been an upbringing such that your mother is always pushing you to attain more than you thought you could ever achieve. Because if my mother didn't put in that input to want me to better myself each and every day, I don't think I would have become a doctor. I would have done something much easier.
Yeah. I feel you. My mom is the same. Yeah. I understand completely. What are the best parts of being a doctor?
The best part is you meet a lot of interesting people. You get to connect with so many people. And the second thing, which is actually the most important thing, is actually seeing that you made an impact in someone's life. There was one time when I had a patient and I did something for this patient. The patient had a jaw dislocation. I think that was back when I was in surgery. The patient had a jaw dislocation, so this woman couldn't even open her mouth. She was in so much pain. So I knew what to do. And there was like a bunch of students there, and I think my other colleagues were there, and we were all waiting for the boss. But in my head, I knew what to do. Like, okay, this is what I have to do for this woman to help her. Okay, fine. So the others tried, and it didn't work out. And then I was like, anyways, let me try. I just went there, reduced the jaw, and that's how that woman, like, instantly you could even see the happiness on her face and the relief on her face. I think that's one of the best things, to see that you're actually having an impact on people.
Yeah, I understand. Like, that must be great. I can't wait until I can do things too.
You will.
Big things.
Very soon.
What are the worst parts of being a doctor?
I could write a book.
Oh my god! Oh no.
Okay, so I think the single most worst thing about being a doctor is having to deal with death.
Oh yeah.
Having to sit a mother down, having to sit a father down and telling them that their son has died. That, I think, really changes you. And no matter how many times you actually do it, you never really get used to it. It's never the same. Every experience is different, every person that you deal with. And it's worse off with the patients that you actually get attached to, where you are fond of this patient and then you come and this patient actually passes on. That's very, very difficult to actually get over in medicine. And that's the worst part of medicine.
Oh wow, that's intense.
It is. Up to now, like every single patient that has died in my care, I remember how they look like. I don't necessarily remember names. I'm very bad at names, but faces I do remember. So every face of every patient that I've ever come across that has died, I have their face in my head, and sometimes it kind of haunts you. I don't know, but it's worse.
And how is it on your mental health?
You need to find something that you have to unwind in. I do music on the side, so.
Oh really?
Yeah, I do music on the side. Not really singing. I have a very horrible voice for singing, but I do produce music. I make beats. I write lyrics, and I have released a few tracks here and there. But it's not an official thing. It's just one of those things on the side.
Oh my God! That's like a whole big hobby.
Yeah. I'm like a jack of all trades, if you can actually describe it like that. Because I've always believed that you can do anything that you set your mind to.
Wow, that's so interesting. So, do you also believe that your life doesn't have to be about only medicine, and you're free to have a life outside of medicine?
Well, I always say this. I always ask people this question. If I had a chance to choose what career I would actually choose again, I think I would still go for medicine. Regardless of all the hardships, regardless of everything that I've gone through, I think I would still choose medicine. It would maybe be a preference of going to a different school, but I think I'll still choose medicine. Or maybe even a different country, but I will still definitely choose medicine.
Why a different school? That is interesting. I got that.
No, I've nothing against my school. Nothing, absolutely nothing against my school. It's just that you just need a different environment. Unless if you're saying that I'm going there without the knowledge of what I have right now. Because if I went to go back there with the same knowledge and the same experiences and then do it all over again, that would be draining. Very, very draining.
And also very creepy.
Exactly.
I agree. How did you get into teaching?
So it was back in third year. So we have a family friend that it was a year behind me. I think because my sister, I, and the family friend started at the same time. I had gone into second year because I'd already done the first year of A-levels. Then my sister decided to take a gap year. So she started in the first year because she didn't do any A-levels. And my other sister's friend, the family friend. So my sister did pharmacy anyways and branched off into pharmacy. Then the family friend is in medicine. So it was back when they were learning biochemistry. Then she asked, can you help me about this topic? Then I just came, she was with a friend, started teaching, and all of a sudden I just kept attracting attention from other people, and before I knew it, there was a huge crowd there at that moment. And then after that she was like, oh no, can you teach me any other topics? Then it kept on going like that, and then that's how she came and she talked to me. She was like, you're really good at this. Why don't you actually start a business? Why don't you start teaching people on a daily basis? And that's how I think it all just started.
Whoa. So the rumor about you teaching 7th years when you're in 5th year is true?
No.
That's actually one of the questions.
No,
that's part of the myth.
No, that's not entirely true. Okay, I've spoken to some seniors that have used my material when I was in 5th year, but teaching them, that's not true. I actually learned a lot from the 7th year. We had 2 very good 7th years that I used to bother a lot, and I was always with them, and I made sure that they taught me everything that I had to know to survive and become independent in the clinical aspect. But I didn't teach them. No, I didn't.
Okay.
I wish I did though.
What inspired you to write an entire book?
So the books, I thought to myself, it's, how we read books that are made by certain authors. You read a section and it tells you, okay, do this for this patient, but we don't even have that in the country. It's like books that are not even relatable to the country. They're giving you drugs that you don't even use in the country. So I thought to myself, why not create something that is relatable, something that each and every single medical school can use? It started off as a small thing, because actually the books that I have, it's not just with the clinical years, it actually started way back with the preclinical books and stuff like that. It started with histology, if I'm not mistaken. I had this pamphlet where we had these histology labs where we had to look at slides, like a lot of slides. So I decided, let me compile these slides and add a few texts here and there, explaining a few things here and there, and then put up something, and people were actually interested and like, oh no, you're good at this. And that's how I actually branched off and started doing other things as well.
Oh wow, that's so cool. Yeah, an entire book.
Yeah, it's actually been, if I could say, 3 years of work, because it started in 5th year. The books that people are using now in 5th year and 7th year, I started writing them when I was in 5th year.
Whoa!
Then took a break and finished. I didn't finish them; they're yet to be finished, and I think I will finish them soon, very soon. Hopefully, I will finish them soon. But it's more or less. My dad also had a big influence in this, because my dad also writes, but he doesn't really type his work, but he writes his work physically. So he used to tell me, can you type this content for me? So that's how I actually got very good at typing, to a point where I even type with my eyes closed or even in the dark.
Whoa.
I can still type and it would still make sense.
That's intense.
Very, very intense.
So that's how you were like able to write an entire book.
Yeah.
So you must have loved like lab reports and assignments, because it's so much typing and so much writing.
No, I've always hated lab reports. I've always hated assignments, and I don't prefer them. I'd rather just learn in class. Give me a test, I'll write the test. Or sometimes if you just trust me that I know the stuff.
Yeah, thank you. That's what I always say. Like, why don't you just believe me? Like, I know.
Exactly.
We don't have to do this whole game.
Yes.
Yeah, that makes sense. What would you like to specialize in?
I would like to do cardiology. I think the heart is rather interesting. My initial specialty was, I wanted to choose neuromedicine, but I later on changed my mind because it wasn't as interesting as I thought it was. But cardiology is what I want to branch into.
Oh, okay. I can't believe it. Why wasn't it interesting?
I don't know. I just lost interest. I loved cardio, and when we were learning the cardio topics and the love that I just developed, I was like, okay, this seems very, very interesting, and I see myself doing this forever.
Oh, wow.
Yeah.
That's so cool.
But who knows? I may end up somewhere else.
Yeah, it's too early.
Yeah.
What advice do you have for the new generation of doctors who are currently being trained?
Don't miss the words. That's all I can say. Don't miss
the
words.
Yeah.
Because there are some things that you can't learn from a textbook. There are some things that you can only learn by seeing someone else do it. There are some things that you can only learn by being there in the moment and actually you doing it in the moment. And the second thing is that the road is not entirely easy. There's going to be a lot of ups and downs, and just don't give up. If you want to be a doctor, don't give up. It may take you 7 years, it may take you 15 years. Don't give up. Just keep doing it.
Wow, that's good advice.
Yeah, it is.
Yeah, especially since results are about to come out and everyone is stressing. And you're like, it takes 15 years. It's like, okay, so it's okay. What is your biggest regret in your medical journey so far?
Biggest regrets. In medical school or after medical school?
Oh, from medical school till now.
From medical school till now, my biggest regret. I don't think I have any.
Whoa.
I don't think I have any biggest regrets. Yes, I've made mistakes, but I don't regret making those mistakes because those mistakes made me who I am. Of course, I haven't at any moment up to the current time made a mistake that has directly led to a patient dying or anything of that sort. I hope I don't make such mistakes, but I have made some mistakes here and there where you miss a few dosages here and there, you miss a procedure, but I haven't made anything that's so significant that would lead me to regretting my existence or anything of that sort. So,
okay. That means you led a very peaceful journey.
Well, not really. Again, anyways, you can't really judge. You can't really judge. Sometimes it's like you're not able to see your entire self, because there are some patients that you see, then they go away and they never come back, and you never know what happened to that patient. Did they go and die? Did they go and have a complication, or did they go and they were healed? We assume that when the patient doesn't come back, everything is okay. But what if they died?
Oh, I've never actually thought about that.
Exactly. What if they died? What if they went back?
You really think about that?
Yeah, I always think about that.
Oh.
Especially when I was in surgery. There was one time where I had a case of a guy that came in, and he was a construction worker. A brick fell on his foot and like almost ruptured his entire nail, was disconnected. His toe was also cut, and I think I had to suture him up. So I was really curious about that patient, on how they would come back. I sutured up, and I never really saw the patient afterwards. So I don't know if the patient actually completely recovered or they didn't. So I assume that they did, or maybe the other doctor saw them.
Oh man, that's gonna stress me out.
But don't think about it too much.
Okay. What is the most interesting case you've seen so far?
That must have been the first day of my internship. Very first day. I had a case of a girl. The girl was roughly around 12 years. She just came in, and one leg was lengthening, the other one wasn't. And that was like the first day, the first patient I ever saw.
Oh my god, that's so complicated.
I know.
So what was the reason?
So initially I didn't know what I was dealing with as well. So I consulted my other fellow intern, and he thought maybe this girl has an osteosarcoma. So let's get some leg x-rays. That's how we sent the girl for leg x-rays, and came back, and we consulted the ortho registrar, and he was actually very nice. And I think he told me what to do, that order skin traction, admit her to the ward, but he didn't mention the diagnosis to me. But then later on during the day when he came by for a round, that's how he told me that she had Perthes disease, which is she had some injury when she was playing one game, and it led to some necrosis on the femur, and it stopped growing or lengthening. That's how the other leg kept growing and the other one stopped growing.
Whoa, that's like a case from House.
Yeah, it was. I get very weird cases, especially on first days. That's why I never look forward to any first days in any department.
Okay, another one. I just want one more.
There was another one who fell into a grinder, actually.
A grinder?
Yeah, a grinder. It was very gruesome.
Like a meat grinder?
Yeah.
You just fell in it?
No. It's like, I think he was injured. He was working at some, I don't know if it's butchery or some company.
Oh.
And then eventually it like got like a lot of damage on his thigh. But we managed to salvage, and he, believe it or not, the man can walk. Like now he can walk, and it's like nothing happened to him. Like if he's wearing trousers, you can't even know that he had that significant injury.
Whoa.
So yeah.
People really injure themselves.
Especially in surgery. I saw a lot of things. In surgery. A lot of things. And especially the you know what's the thing about, I don't know if it's God or the universe or how it works. When I'm not there, we don't get a lot of these cases. Immediately I'm there, it's like they keep coming. It's like someone tells them, no, he's there, please let's go now.
Yes. Oh my god. That's very stressful. Okay, so I'm currently in my first year of clinical rotation, and it's been an interesting journey. It's been a very interesting journey. I love it. I love being in the hospital and finally getting to see things up front and getting to like do things, because the last couple of years we've just been in class, and yeah, so that's been interesting. But I'd like to get some advice about OSCEs.
Okay.
Like, what is the best way? Okay, so we wrote a surgery OSCE, and it was horrible. It was like the worst thing ever. Like, it was really terrible. And the PIS OSCE was fine, but the surgery OSCE was really terrible. So what advice would you have for surgery OSCEs?
To be specific. Okay, there's general advice for the OSCE stations. The first and foremost thing, breathe. I know. Just breathe, take a deep breath. You have what, 5 to 6 minutes for each station?
Yes.
I think the best approach is having a template in mind and having a set of questions that you expect. You see? So for example, if you have surgery, you think to yourself, okay, what are the common things that are going to be there in surgery? So if I'm an examiner and I'm actually setting an exam, I would make sure that maybe I could bring something on burns. Suppose I'll have a station where there's a child with burns. What is the possible things that someone could ask me about burns? Maybe how I can assess burns, maybe how I can classify these burns on this child directly there, or maybe how I can examine this child, or maybe something in relation to burns. Such that once I'm now preparing for the OSCE stations, I have this template in mind of the questions that I'm going to expect from the exam. And then once I have this template in mind, when they ask me, I have a nice trick. When they ask you a question and you don't know the answer, repeat the question in your mind. Not saying it to the examiner, but repeat the question in your mind before you answer. Because most of the times people have this tendency of just answering a question minus them actually understanding what is wanted of them. So first I repeat, if someone asks me what is obstructive jaundice, I would ask myself, what is obstructive jaundice? This gives me time for me to think and compose my thoughts, to calm myself down, and then eventually speak and tell the examiner what I think obstructive jaundice is. If I get it wrong, then so be it. If I don't, if I get it correct, then yay me.
That actually makes a lot of sense, because I was like getting nervous. I think like halfway I got one question wrong, and it was like a point diagnosis, so if I didn't know it, I didn't know the rest of it, and that really shook me up. Then when I went to the next guy, I was so nervous, like things started to get mumbo jumbo in my brain. So I think if I just stopped and asked myself like, what is blah 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 blah, then I would have calmed down.
Exactly.
But that was really stressful though.
But the anxiety never finishes. Trust me, the anxiety is always there. I'm a person who actually has these anxiety attacks from time to time. I am actually a very anxious person. Very, very anxious. If you're very observant, you can actually notice it. But if you're not, I doubt you can notice it, because I've learned to cope with it. I've learned to cope with my anxieties. Even when someone asks me a question on a word round, and I have no idea what the answer is, my heart will just be racing, and I can even feel my heart beating in my neck. That's how anxious it is.
That's intense.
So it never ends. Never.
Oh my god. So like, how does it work, you being so anxious and being in medicine?
Well, you just have to learn to live with it. That's one thing that I've had to learn to cope with. So I have this coping mechanisms. Like I said, repeating the question is a way that I help with myself cope. And then another thing is telling myself that it's okay to get things wrong. I've always told myself, I've always had this burden on my shoulder ever since medical school. And always when I say something and it's wrong, and then everyone is just so surprised around me, and I'm like, I always tell them, I'm also human. I'm bound to get a lot of things wrong. So that also helps take off a bit of some shoulder pain off, and some of the burden off, when you know that you can get some things wrong, and it's okay to get things wrong. It's okay not to get 100%.
Jeez, getting things wrong in the words. It's very stressful.
It's okay.
Yeah, in theory, it's okay.
Now, let me give you some perspective. Imagine you were in my shoes, right? And you have everyone around you expecting to get everything correct, all the answers, expecting you to know every single thing.
Yeah.
And you don't. Or someone asks you a question and you don't know the answer. That's anxiety on level 100, if I can describe it like that. But you just have to tell yourself, okay, it's okay to get things wrong. It's okay.
Do you feel pressure to know like everything?
A lot actually. The pressure started off in medical school. You know how you write exams and you have students worrying about, will I pass the exams or not? I wasn't even worrying about that. I was worrying about what happens if I don't pass the exam. How are people going to view me?
Yeah.
How are my students going to view me? How is my family going to view me? How is everyone going to view me? Will I be able to come out in public ever again.
I feel you. Oh my god, I
So,
felt
yeah.
that stress. Yeah.
It's normal. It's normal.
Yeah, I guess that's what you say. So you mentioned that when you're in fourth year, you were ready to quit, and your friend talked you out of it.
Mm-hmm.
So why don't you return the favor forward? And I'm sure there's some people right now who want to quit. What would you say to those people?
If you feel like quitting, take a break. Find something that will help you unwind and still get you perspective. Ask yourself, why am I doing medicine in the first place? Why am I studying? Why do I feel like I want to quit? Then find a solution to that. The best is find someone that you can actually really talk to, and someone that can advise you, someone that's close to you. And this actually really, really helps, especially at your lowest moments when everything is not working out. Because I can assure you that you will get moments where things are not working out. You will get moments where you feel like as if you're not enough. Even there are some moments where I've put my heart and soul into a paper or into an exam or a test, and I just didn't get the results that I wanted. It's part of life. It's part of growth. It's part of learning. The medicine will always be there. It has always been there, but what's now going to be making the difference is you not giving up and you finding that source of comfort and that source of encouragement for you to keep going on. So that's, I think, what I would say to someone who is on the edge or hanging by a thread and about to give up.
You heard it, guys. Don't give up. There's hope at the end. This is the hope. He's showing us that it ends at some point.
Yes, it does. It does.
Okay, that makes a lot of sense. So, when it comes to studying, what would you say is like the best method for studying?
Well, if you look at the number of people that we have in the world, we have roughly, let's say, 7 billion people. Now, each and every individual person is unique, and each and every individual person has unique capabilities, unique talents, unique way of a thought process. So just like that, because there's no two people that are the same, even identical twins have different personalities. Same thing with the study methods. There are going to be different study methods that are available. You have to find what works for you. There are some people that are visual. They like looking at a lot of pictures. So draw when you look at a lot of pictures. There are some people that work with flashcards. At one point, I even tried audio lectures where I would record myself reading something in a textbook, then play it in my headsets. I ended up sleeping, and I realized that that's not for me. There are some people that work with videos. I love videos. Videos always help open up the horizon to every single thing and actually help you see things in a very different manner.
Yeah.
So I love working with videos, and I also love reading shorter textbooks, the smaller textbooks, summarizing my own notes, not really rewriting another person's notes, but summarizing my own notes from my understanding of what the author is trying to communicate with me.
That makes a lot of sense.
Yeah, it does. So it's just about you tailoring it to your own capabilities or what you think you love. If you love watching cartoons, watch videos that have animations. If you love reading, read as many textbooks as you can. If you like making flashcards or revision notes, do that. If you just like taking practice quizzes after that, do that. Everyone is different. There are different techniques, but there are some aids that you can actually use when studying. There's what is known as a memory aid, which is the secret that's actually behind all my textbooks. The way I actually structure my textbooks, I always get these comments from many different people that say, your textbooks are very easy to read. How is it that I can understand when I read your textbook, but when I read any other textbook, it's very difficult for me to understand? Well, it's easy because of the memory aid that I've added in the textbook. What do I mean? The way I've structured my information is in the most logical manner. So suppose if you want to go to town, you would say, okay, fine, I first have to prepare my clothes, what I'm going to wear, I have to prepare my transport, how I'm going to get there. So even in my study notes, and when I'm making my study notes, I put it in a chronological manner such that when someone is reading, if there's anything that is relevant to the subject, I will put that at the first bit, and then after that, it'll flow from maybe a definition of a condition, or maybe something that's relevant. Suppose I'm doing hypertension, right? I would say maybe something about controlled blood pressure, some terms that you need to understand before you go into the pathology of hypertension. Then after that, go to the clinical features, investigations like that. And I make sure that it's in bullet points because people remember things that are shorter as opposed to things that are longer. So those are just some memory aids during studying.
Oh, okay. Thank you. That is actually great. Okay, so that is all my questions. Do you have anything you'd like to add?
Anyone who's studying medicine, please don't give up. It's fun to be a doctor. We need more doctors, and I hope you have found this very enjoyable, and I'll see you next time.
All right. Thank you so much.
Yeah.
Bye.